Hi, I'm Dr. Sonali Kohli. I'm a board-certified dermatologist and a fellowship-trained laser and cosmetic physician. Thyroid and hair loss. The current times that we're living, both these conditions have become extremely prevalent. A lot of people are developing thyroid, and as we all know that hair loss has become extremely rampant. Now, what is the real association between these two? There are two types of thyroid which we commonly encounter. One is hypothyroidism and one which is hyper. And as the name suggests, in one condition your gland is not working to its optimum, and in one there is excess activity which is seen. To keep it as basic. Now your hair goes through three cycles. There is a growth phase, a resting phase and a falling out stage. When we develop clinical hypothyroidism, where there is underactivity of our thyroid gland, what happens is that the hair end up staying in the resting phase. They do not get the trigger which is needed to get pushed from their falling stage into the growth phase. As a result of which, in the beginning you will note that there is a stagnant growth. There is no growth actually which is visible. Along with this, there is shedding of hair which becomes prominent. These symptoms can actually onset much before the diagnosis of your clinical thyroid. During this phase, patients can notice that there is an increased surge of hair loss, and the onset can sometimes be very acute. In cases of hyperthyroidism, however, there are certain reactive oxygen species which affect your hair follicle, which leads to the appearance of your hair becoming very brittle and dry, and there is increased breakage. You must understand, when we have hair loss, there are different types. There could be hair loss which is occurring at the mid-length, which means there is increased breakage because of the weakness of the cuticle of your hair. However, sometimes you will notice that you are losing the entire length of the hair, where the hair follicle can actually be seen when your hair falls out. Now, this is important to differentiate because causes of hair loss which lead to the fall of hair from the root could be more internal. Whereas when you have mid-break hair, that could actually be because of excessive chemical treatments. It could also be because of certain excessive blow drying habits which we might have, which are weakening your hair cuticle. And in certain cases, as I mentioned, with hyperthyroidism, there could be increased brittleness of hair and nails which is visible. Do not overlook this, and if at any point you feel and there is a genetic predisposition to have an autoimmune disorder, do discuss with your practitioner whether you can take a look at your thyroid levels and understand if that could be an underlying factor for your exaggerated hair loss.